visible now?
Yeah, it's
Hello?
sharing, not yet
Hello?
not yet shared. It's sharing.
Am I audible?
You are audible. It's showing screen sharing.
Okay. Uh, so,
If any issue,
so
you
I'll
forward me. Yeah, I
say,
will send to.
Apurva Karde say. So, is it visible now?
Screen
Yeah,
is
I have
not yet
forwarded.
visible.
So, even the PPT is not going.
Previously, it was shared now.
Yes, ma'am. Previously, it was sharing. Actually, so happy Navratri to all. And because of Navratri and the Gabba ground is nearby, so internet overload is too much. So I guess internet issues will be there today.
You send it to me. I'll send to sir.
Yeah, ma'am, I have sent, but it is also loading.
Not going. Okay, okay, okay. Oh, shared, shared. Okay, he continue.
Okay.
It's visible now.
Okay, ma'am.
Yeah,
2 minutes. I will
carry on.
start my PPT then.
Start. Hmm.
Is it visible now? Are the slides
Yeah,
moving?
visible, visible, visible.
Sure. Okay, super. Oh, shit.
If you are not able to move, you click the next slide and then it will be visible. Okay.
Okay. So अज्ञानतिमिरान्धस्य ज्ञानाञ्जनशलाकया चक्षुरुन्मीलितं येन तस्मै श्रीगुरुवे नमः. So, Hari Om. Namaste to everyone present here and pranams to all my gurus. And so, I'm Dr. Vasuprada. As an assistant professor, I'm working in the Parle Institute of Ayurveda, Vadodara, Gujarat. Uh, Hello? Yeah.
Yeah,
So,
audible,
I've been working
audible,
for 3 years. And
audible.
yes, ma'am. Yes, ma'am. So let me start with the golden words. So thank you, Dr. Kamini Dima ma'am, for giving me this opportunity. Thank you, Dr. Gayatri Bhatt ma'am, my teacher and HOD in SDM Hassan, whom I have learned quite a lot, and my guide also, Dr. Pratima, and all my teachers, my UG HOD, Dr. Anuradha Maganti, right now working in the Punjab Chandigarh College. And thank you, Dr. Pawan sir, for introing me. And so, yeah, let's dive into the today's topic. So today's topic, give the lecturers how I am perceiving the PCOS or understanding the PCOS. So I do welcome all criticisms, either positive or negative, for my growth. So, I'll be happy to share. So, namaste, and this is my Kula Devata. So, let's move on. So, yeah, I am Dr. Suprada. Again, I have shared my email address if you want anything from me. And yeah, starting from this, we have, I guess many of us have seen usually the righteousness and the evilness. Right now, we are in the Navratri period also, where the this Rama Ravana Yuddha was going on, triumphant over evilness, and everything is going on. So, why I have put this picture here is, see, the right part, Narasimha is described as what shown very small with 2 hands, rather than the evil forces with 4 hands, wings, and they are getting big than the right. So, start when we see things, but the takat inside, the sankalpa inside is going to win because it is good. So also I would like to share some other a bit small story. So we know four yugas are there: Satya Yuga, Treta Yuga, Dwapara Yuga, and Kali Yuga. So in Satya Yuga, there were two different universes where good universe was there, bad universe was there. So that time, and the next I'm sorry, and the next yuga comes to Dwapara Yuga. I'm sorry, Treta Yuga, Rama, and in that, in the same world, both good and evil existed. Rama and Ravana both existed in Manavakula. And coming to the Mahabharata, that is Dwapara Yuga, and good and evil existed in the same family, say the Pandavas and the Kauravas. In Kali Yuga, it is good and evil resides in the same person. So it is up to us where we decide to go. We either we are going to attain the moksha, or we are going to Patala. So with that, let us start. And obviously, Dharma, Artha, Kama, Moksha. Moksha is the ultimate attainment of Ayurveda's teaching. So let's go into that. And I'm not going to give much intro about PCOS because September is the PCOS awareness month, and everybody has been everybody everywhere it is PCOS, PCOS, PCOS. So I'm not going much into this. I'll just give a very small intro. So it is also known as the Stein-Leventhal syndrome. It was discovered in the 1935, and this is the most commonest heterogeneous multi-system endocrinal abnormality in women. Obviously, when it concerns women, everything is an endocrinological play because whatever happens from the puberty, during menopause, after menopause also, because after menopause we can say like there are no hormonal play. That is the issue, because once the hormonal play starts, until it ends or after it ends also, it creates a problem. So yeah, and it is the most commonest cause of the secondary amenorrhea too. And so when coming to the prevalence, priorly now it has come down to in four people, if we take one female is having PCOS or identified or diagnosed with PCOS. So it has become so common in nowadays. So yeah, what are the risk factors? So first is the genetics, because say in like even in 1990s, or even when I was doing my UE, PCOS was not prevalent thing. Much prevalent was Ashragdara, I would say, fibroids, I would say, not PCOS. And yeah, because when I was doing PG, there was not much technology. And we are not blaming technology as a culprit for all the lifestyle disorders, because technology is a, what I would say is a knife, and either we can cut vegetables, or we can cut something else, or we can murder someone else. So it is upon the decision is upon us. So what we choose, again, what we choose. So that is the issue. And because already a generation, because this is almost like we are 20 years ahead of the in the 20-25 years, almost a quarter of a century ahead, and the technology advancements are, oh my god, so good. And but there are many disadvantages of that also, and because of that, first generation and second generation problems, they had problems, and because of that, those problems became genetics. So monozygous twins with PCOS is, it is like one, in monozygous twins, if one twin is having PCOS, and it is like 70%, the other twin will also get the PCOS. And obviously the first degree relatives, either the sister or the mother, or like Masi, like blood related Masi, not like Bua and all. Because the father's side, there is no maternal genes, right? Obviously, it is father's gene. And obviously, the environmental influences we will talk about in the further slides. And coming to the obesity, prepubertal obesity. Yeah, and right now, there is no much outside activities, everything is inside where you sit. And because of that, even the children are not going to play outside. Even if some children are willing to play outside, or do some exercise, they are, even parents are not allowing it, because one, the environment is polluted, two, safety concerns are there, and three, and because the over pampering, I would say, because of that, the prepubertal obesity is being too much, and because of that, hormonal issues start. Because during the ages like adolescence, from the childhood to adolescence, the energy is more because it's kapha, right? So energy is more, and it has to be, and the energy has to be spent. Only then it is the right use of energy is there. So if it is not there, obviously it is going to get deposited somewhere, and because of that, obesity is there, and because of that obesity, every other problem is going to happen, which we are going to see in the further slides. So early onset of menarche is also there because again there is no much activities, physical activities, and the large and small for gestational age. This usually IUGR happen, or IUGR, or large for the gestational age happens in the GDM and the other preeclampsia or hypertensive cases. So already the mother has the predisposition of diabetes and hypertension. So obviously the child is also, the female child especially, is also going to carry that epigenetic material from the mother, and obviously it is going to result in almost 50%. Researchers say 50% chances are there for the female child to have PCOS. Nowadays we are seeing like the fetus in utero itself is having polycysts in the ovaries. And again, drug induced is valproic acid. Because of the valproic acid's action, there is what stimulation, there is more FSH, and because of that there is, and the ovulation is not proper. Because of that, there is polycystic ovaries, not disease, ovaries. And yeah, coming again to these symptoms, we all know first is infertility and acne, acanthosis nigrans, high testosterone level. Because of that, hyperandrogenism. Because of that, hirsutism, and insulin resistance. Because of that, skin tags, dermatological issues. Again, I already said hirsutism, body hair growth, alopecia, and from where the area which is supposed to have hair is not having, and the area which is not supposed to have is having hair. So that is the issue. And yeah, then ovarian cyst, because of, and multiple follicles cause ovarian cyst, or even simple cysts sometime, and irregular. And usually what we see, what I have seen in clinics is how patients come is only because of irregular periods, not because of hyperandrogenism. OPD is trouble conceiving or infertility. And never I have seen a patient coming for PMS or mood changes. Obviously, that people with mood issues and all, they won't visit the gynecologist per se. But again, it is concerning the gynaes. So I would say people has to come, but people are not coming, and because this is the main thing. And obviously, male pattern baldness and male pattern obesity also. For the we all know there are many body shapes, but female body shape, mostly the fat is deposited in the pear shape, and the male fat deposition is the apple shape, where the fat is below the diaphragm. And because of that, males are more prone to heart attack rather than this mental issues is the main problem females are facing, especially in the adolescent phase. Because priorly, I don't want. Sometimes I might be labeled as a conservationalist or traditional or old panchang, I would say. I don't know, colloquially we do say that. So, and because of priorly how it was like, obviously lack of technologies, everything was done by the females in the house, and I would say like, and because of that, there was more physical activities. I have like when I was whenever we have summer vacations, we go to the Nana Nani's house and we have a well there. We used to draw water from the wells. We used to garden them. And nowadays, kids, they don't have that luxury. So, and because of that, they are not exposed to many factors in their Am I audible now? Until when I was not audible? Hello?
Yeah, audible, audible.
Okay. So, I'm sorry, until where I was available? Okay, anyway, so let me continue. And yeah, the children nowadays, Gen Zs or Gen Alphas, don't have the luxuries going to the or playing in the mud or gardening, or even if they have gardening, they are going to garden in the terrace or what their balconies. That's all. And they don't have that luxuries, and they don't have that smell of soil mixed with water and all. They don't have the what to say, the happiness or the ecstasy of playing with the clays, like real clay, not like playing clays which is available in the stores. And because of that, they are not exposed to many factors in the
Your
environment. And
PPT is not visible.
okay, sir, I'll do it. Just a sec. Visible now, sir? Hello, sir, is it visible?
Yeah, visible, visible. The slides are visible. You continue.
Boundaries of what we millennials had, and they don't get much exposure of the world outside, even though they have worlds in their hands. And because of that, it is causing them much mental issues, I would say psychological issues, like and obviously the priorly they were like, at least they were having siblings. Right now they also denied of that luxury. And because of that, they don't have many people to talk also. And because of that, they don't understand the what person to person connection, and they don't build rapport with people. They build rapport with technologies rather. Either it's the screens. Okay. So because of that, they have brain fogs and irritability, eating disorders, depression, anxiety, and OCDs. So yeah, so what is the diagnostic criteria? So we have three diagnostic criteria, and right now we are going with the 2003's Rotterdam criteria, which is hyperandrogenism, where we find the male pattern hair growth and acanthosis nigricans and skin tags. And menstrual irregularity, obviously, it is not just scanty bleeding or irregular bleeding. Sometimes they have asrigara, matlab, menorrhagia also, and polymenorrhea also. And in the next is the imaging with polycystic ovaries in the ultrasonography, especially in the pearl necklace pattern. So coming to the pathophysiology, I know you people are very well with this. So I'll just briefly do this slide. So insulin resistance happens because of that, again, it is a vicious cycle. But so we have to start somewhere in the cycle. So I'm starting with the insulin resistance, and because of that, there is less SHBGs. Sex hormone binding globulin, and because of that there is more free testosterone. That is the sex hormone binding globulin is an enzyme released from the liver, and it is released less because of the insulin resistance, and it is not going to bind with the sex hormones as the name says. So because of that there is more free testosterone, and those free testosterone are aromatized in the peripheries and becomes estrone. And obviously we know there are four types of estrogen, estrone, estradiol, estriol, and estetrol. So the most common in the most good what to say, the thing is estradiol E2, but E1 is what is formed from the free testosterone available, and the other things are, and because of that estrone is there, and it is not going to do the work of estradiol, obviously, right? And this estrone is anyways estrone, I mean, sorry, estrogen, and it is going to mimic the activities of estradiol, but not properly do it. And because of that, the unwanted activities of estrogen happens. Like say, the prolonged exposure to the estrogen causes the endometrial hyperplasia, and sometimes there are growth of fibroids. Sometimes there is a growth of breast cancer, and because of the endometrial hyperplasia and the necrosis, which is going to happen later when the endometrial thickness is going to shed, and again happening of that will cause endometrial cancer, obviously. And because of the continuous what to say continuous Badha in the FSH and LH area. Because of that, the follicles are going to form, the ovaries are going to expand, the volume is going to be more, and because of that, again, there is more estrogen is going to be released from the not fully matured follicles. Again, there is a problem. So there is a problem from head to toe, say like from the alopecia to the bones or osteoporosis, everything there is an issue. So yeah, this is the pathogenesis. I'm sorry, pathophysiology of the PCOS. So next we come to the what modern people do is the investigations with the hormonal profile prolactin, and because of and prolactin they do is because of the menstrual irregularity, and it has nothing to do with PCOS. PCOS and obviously insulin resistance, and because of the obesity, lipid profile abnormalities are seen, and MRIs are seen sometimes when there is severe dysmenorrhea and they don't have the causes for that, and sometimes LFT and KFT is needed, and sometimes because of the palpitations or the anxiety disorders and panic disorders, they mimic the heart conditions because and palpitations happen, and that will they might mimic the cardiovascular issues, and they do I'm sorry, ECG and it goes. And the USG in PCOS, it is how it is diagnosed is 12 or more small follicles of each of 2 to 9 mm seen in the periphery, and volume should be more than 10 cc. The normal volume of ovary is 3 into 2 into 1 centimeters, so which is almost rounded to 6 to 8 cc. But if it is more than 10 cc, obviously it is going to be diagnosed as PCOS. And also it rules out the ovarian neoplasms, and say this is the pearl necklace appearance. This is, I don't know if it's necklace or bracelet. I'm just going to say with the pearl necklace appearance. So yeah. And coming to the factors which cause the PCOS is and prolonged sitting with the head down, glued to the screens is going to cause problems everywhere. So yeah, and the other environmental factors which I said in the risk factors, they are like xenoestrogens is what the new identification, where the xenoestrogens are the estrogens which mimic the estrogen activity, but they block testosterone. And there is let us have a short story here. There's a river called South Platte River in the Colorado, USA. And there was an experiment conducted in the year 2004 by Edwards, who was a retired biologist. He found that there was and this experiment was done because there were from that area where the people consuming the fishes from the pond or the river, they had the 5 boys had gynecomastia. And when we saw what is the cause of this gynecomastia, and when the food was analyzed, they found that 90% of the fishes in the South Platte River were homos. They were not, they actually there were 90% females and 10% male. मतलब नौ मछली के साथ एक ही मेल है, मतलब there is more feminization of the fishes, and because the people who consume that become have more female characteristics. And it was researched why, and because of they found out that the fishes and they obviously the fishes feed from the water and the impurities or whatever the things available in the water. So when they saw what are the contaminants that the water has, they saw obviously the laundry detergents, pesticides, the farms from the pesticides and the other things from the farms, urea from the farms, and the uh, what to say, the detergents from home, the face washes, or whatever the things available from the home excretas. So it was found in the river. And the fishes who consumed that became more feminized, rather than even the males become feminized. And because the people who consumed that obviously had more female characteristics, or the gynecomastia or man boobs. So because of that, it was found, and from that experiment, these xenoestrogens were identified. And also there were another experiment on the lavender oil and tea tree oil, which caused gynecomastia. And they also caused and this same biologist experimented this same two oils with the breast cancer cells, and they are caused to multiply the cells of breast cancer cells. They are not curing it. In fact, adversely, it is increasing the breast cancer. So yeah, they mimic the estrogen and they block the testosterone. This is the xenoestrogen's property. And how are we related to that? So yeah, the aluminum cans or the aluminum foils which we use to take parcels, and the plastic polythene bags which where we take chai parcels, and the fast food, obviously the oils fried again and again in the same oil, and obviously the plastic bottles and the water cans we use. So everything is has BPA contained in it. The cash register receipts and microwaved popcorns. Obviously, when we go for a movie, we will go and eat a popcorn. And when obviously we are going to have a chai, and that cup contains BPA, that water bottle contains BPA, and the other deos and all the makeup products which contain this triclosan and phthalates. And obviously female are more they use this what makeup items. And obviously I'm not saying the males are not using makeup items. Females tend to use it more because they are targeted. And because of that they have more exposure of these estrogen mimickers, and because of that they are we can say like PCOS is it is not feminizing, it is turning the female into a trans or a male. But here, these things, which estrogen mimickers, again, it is not going to feminize the female. It is going to, even though it says like it mimics estrogen, again, it is going to increase the E1 rather than E2. So yeah, these are the endocrine disruptors, chemicals which are seen in the makeup products, especially the phthalates, pesticides, and the BPs and the parabens, which are very common in the face washes and the shampoos. And we can now see like paraben-free shampoos, and this free that free this. And but some or the other chemical will be there. And we have seen the black color the use and throw plastic trays, where the food comes in a parcel, especially in the railways and all, or somewhere they take fancy railways. Those black plastic, again, they are not food grade plastic, and they are obviously going to cause the increase in the xenoestrogens. So yeah, then what are the hormonal changes? Ultimately, it is caused this testosterone is increased. And then obviously the DHEA is increased, androstenedione is increased, all the male hormones are increased, and LH is increased. Rather, I would FSH remains the same, or because of the LH increase, FSH seems like it has decreased. So the ratio between LH and FSH is 2:1, more than 2:1. Actually, it has to be 3:1, but it is now it is बराबरी हो जाता है या 2:1 हो जाता है. Yeah, so SHBG is obviously decreased. We spoke it in the earlier slides, and the total estrogen is increased. That is, E2 is decreased than E1. So yeah, what is the differential diagnosis where we go is hypothyroidism and the hyperthyroidism. Why we consider this is like obviously the metabolism is hampered in the because thyroid hormone is responsible for the metabolism, and the hyper or hypo is going to obviously hamper the metabolism, and it is going to cause either high menorrhagia or scanty menses, oligomenorrhea. And obviously hyperandrogenism, matlab simply hyperandrogenism, not concerning with the PCO. Hyperprolactinemia is in the lactation period, or some pituitary tumors can be there. And congenital adrenal hyperplasia, where the aromatization is more, and because of that prolonged estrogen is there, which mimics the PCO, and obviously obesity. So, what is the treatment advised by the allopathy people is obviously first the lifestyle modification, which we are also going to advise, and the keto diet and the DASH diet. You people are well aware about the nutrition nowadays, and the OC pills, which I call like Sarva Stri Roga Nivarani and Kaya Roga Karani. Like why I do say this is like Stri Roga, which for whatever the problem faced by the female, first drug of treatment is OC pills. Obviously, either it is POP or combined COP, combined oral pills or progesterone only pills. So because of that, and obviously there are more side effects than the effects of the than the benefit, I would say, effect. So yeah, it again causes obesity itself. It will cause migraine. It will cause breast tenderness. It is going to cause you bloating and all. And yeah, it is going to treat the menstrual irregularity rather than treating the anovulation. It is going to cause the treat the menstrual irregularity, but it is going to cause other problems. Kaya roga karani. The KC people, KC rogas are more, and Stri rogas are very less. If you consider, if the person is advised with OC pills, yeah, then metformin for the insulin resistance, and anti-androgens for the hirsutism and the nape of neck blackness, that is the acanthosis nigricans, and ovulation for, and if the female is seeking fertility, ovulation induction drugs are there, like clomiphene citrate, letrozole, and things. And the inositol is the latest discovery of them, and the counseling for psychological issues. And for the other complications, say like if they have for the dermatological issues, they go for laser abrasions, laser hair removal. I'm sorry. And for the other things like heart health, they will again go for screening for that, and whatever the complication may be, it is treated accordingly. So this is the medical treatment. Drilling is possible, and I don't see why this is help in the treatment, because in the periphery, they where the pulse peripherally arranged is going to be drilled, and the fluid is going to be left out. But again, the follicles are going to form. This is not treating the underlying content, which is inside, which is an oxymoron. Yeah, so this is the drilled ovary. This is the ovary drilling and the ovaries which are drilled. But this is again going to cause infertility, because the ovarian surface has more fibrosis, and the ovulation is a bit difficult in these cases. So yeah, my Ayurvedic point of view, and we will talk more about the Nidana and the uh, 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 coming slides. So what is, because of Agni Mandya, the dhatu is not proper formed properly.
Voice is not coming. हेलो वसुधा जी, कामिनी मैडम
मुझे लगता है हाँ वो उसका
आ
सिग्नल
गए।
चला गया, अभी एंटर हुई है फिर से।
आइए आइए।
हम्म। सुप्रदा। हाँ है तो।
वसुप्रदा जी का ऑडियो वीडियो कुछ भी नहीं जुड़ा है।
नहीं एंटर तो हुई है वो। फिर एग्जिट हो गई शायद।
अब ठीक है, अब ठीक है, नहीं आ
Hi,
गई, आ गई।
हम्म।
Namaste. I'm sorry, the internet issues were too much today. It's a weekend and I'll share the thing now. Visible now?
यस यस, इट इज विजिबल।
So, yeah, I have mentioned it is Tridosha and I have mentioned it as Kapha, Pitta and Vata because obviously the Agni is Manda because of the sedentary lifestyle and the Rasavaha Srotas is Rasa is not going to be properly formed and because of that,
आदरणीय कामिनी जी, लगता है पशु प्रवाह के
यहाँ
वहाँ।
नहीं इंटरनेट इश्यू हो रहा है शायद उसके, है
हाँ,
ना, वो दिक्कत लग रही है।
उसको दिक्कत लग रही है। स्पीकर अच्छी है,
हम्म।
बहुत अच्छी स्पीकर है।
हम्म, हम्म, हम्म,
तो
उसको।
आप चाहें तो इन द मीन टाइम आप एक्सपर्ट्स को इनवाइट कर लें।
हाँ इन द मीन टाइम एक्सपर्ट्स का ओपिनियन ले लेते हैं, है ना, जब तक वो जुड़ती है तब तक। अगर किसी का क्वेश्चन है अभी तक उसने जितना बताया उसमें से अगर डाउट है तो भी हम क्वेश्चन भी ले सकते हैं और ओपिनियन भी ले सकते
hello.
हैं। हाँ
Yes,
आ गई।
हाँ मैम एक
हाँ
मिनट
बोलो।
I'll start. So yeah, we saw the dosha. This I mean doshas, kapha, pitta, and because of the the artava agni is not there properly because of that vata is going to be a problem. Then coming to the dushyas, that is dhatus, when the obviously we saw rasa problem is going to be there. Obviously, Uttara Dhatu problems are going to be there. Rakta, we can see, Pratyaksha, we can see the menstrual irregularities are there. Mans Dhatu, again, because of that, because of Medha, Mansa is going to be hampered. Mamsa is going to be hampered, and Medha, we can see like Spix Tanodara Lambanam, Medhovritti, we can see Asti Dhatu because of the Loma growth which is the Upadhatu of Asti Dhatu, and also because of the hormonal imbalance, we can see osteoporosis and brittle bones in the PCOS patients, and we can say the Asti Dhatu Dushti is also there. Obviously, Shukra is going to be there. And because of that, Oja Dushti is also there. Sometimes people don't have Urja or motivation or to do things whatever they want. And yeah, then the Agni is obviously Dhatva and Jhataragni. First, Jhataragni problem will be there. Next, obviously, the Udbhavasthana is Sama and Pakvashaya, and it is going to cause Vatavritti again because of that. And Rasavahi to Sancharasthana is Rasavahi to Sarvadeha because, yeah, all these Rotases are involved. So obviously, all the Sancharasthana is going to be a problem. That's why it is a syndrome, right? It's not a disease now. It's a syndrome. Yeah, and then Dushti, when we come to the Srota Dushti, it is either Sangha or Atipravati. And Rogamarga is obviously Antara. So what do we take it as? Priorly we say it's a $1 million question. Let's now it is Atmanirbhar and we let us go Indian. So it's a crore rupees question. So what do we take it as? Staulya or Prameha because of insulin insensitivity, or it's a Granthi because there are follicles in the ovaries, or it's a Kshudra Roga where the nape of the neck is black, skin tags are forming, it's Kalitya alopecia, and Pushpagni Jataharani where the Nashta Pushpa is there. There is no conception, there is amenorrhea, and it is Artha Vyapad, menstrual irregularity, Yoni Vyapad, again it's the same. And Asrukdara is the excessive bleeding. What do we take? Because every symptom is a diagnosis for us. So what do we take it as? And obviously, we know, like when we don't know how to, even when we don't diagnose it properly, we can treat it because we know the Samprapti. When we can identify the Nidana, Rupa, Purva Rupa, and the Samprapti, obviously we know what is the issue. We just don't need to put a name on it and we can treat it accordingly. So, obviously, from the Tisreshni Charaka Sutra 11th chapter, there are three Vidha Chikitsa, which were तीनों यूज करने ही है यहाँ पे तो टू अटेन व्हाट वेलनेस इन द पीसीओएस पेशेंट एसएप तो ये तीनों यूज करना ही पड़ेगा व्हाट आर दे दैव व्यापाश्रय युक्ति व्यापाश्रय एंड सत्वावजय एंड व्हाट आर द तीसरेशनीय ऑलरेडी वी सॉ इट इज धन प्राण एंड मोक्ष. So this is what the three Ishana way which we are going to do, and for that there many problems are there already. So the Sarvadharman Parityajya Shariram Anupalayat first. So because of that we are going for Chikitsa in three ways. That is Daiva Vyapashraya, Yukti Vyapashraya and the Sattva Vajaya. So Daiva Vyapashraya we will see in the further slides. And so yeah, first we will see the Yukti Vyapashraya and PCOS. We can take it as the Avipako Aruchi Staulyam. Staulya is there, Avipaka is there, Aruchi is there, and because of the menorrhagia, sometimes Panduta is there. Gauravam, obviously obesity, Gaurava and Klama will be there. Pidaka Kotha Kandunam, skin tags might be there. Nape of the neck, acne is the main problem. Acne forms into acne vulgaris, which has like severe itching, and because of that many other problems happen. Alasya will be there obviously because of obesity, again kapha vriddhi, medo vriddhi, and daurbalya is there, and obviously tandra is there, klybia is there, infertility, and bala varna pranasha is there. Obviously bala is reduced and varna is reduced because of this thing, obesity again, and the nigricans and the acne, the kanti is lost, and obviously bahudosha we can prove there is bahudosha condition in PCOS. So for that, what do we do? Obviously, either Shamana or Shodhana. So first we go for Shodhana because, and also not every PCOS patient needs the medications or procedures or something like that. I have patients, like I have say like 5 to 6 patients I have seen where they come and say like, Madam, I have menstrual irregularity, but when I work out properly or when I do yoga and pranayama properly, I get period every month. When we did sonography for them, it was normal, but they did have this thing. Menstrual irregularity was there. Sometimes hirsutism for 2 or 3 patients were there. In those cases, I just advise them to be active because already when they are active, their body is going to function normally. And what is the need of treatment there? So this is only for the patient who needs much more care. So first we go for Vamana Karma where it decreases the Saumya Bhava. Obviously, when PCOS, there is the menstrual irregularity is there, and because of which says that there is no Agneya Bhava, or the very Agneya Bhava is very less. and Saumya Bhava of the Rasdhatu is more. So because of, and obviously Vamana Karma eliminates the Jala and Prithvi Bhava from the body. And obviously, when the Saumya Bhava is decreased, the normal Agneya Bhava will tend to increase in the Nirama conditions. So, Vamana Karma is usually preferred. So, I studied my UG, so I'm sorry, PG from SDM Hasan, where the also we have to take in the Desha also into consideration. Where I studied, it was kind of a jungle, I'm sorry, Anupadesha, where it trains cats and dogs, and it's a catchment area for the river Kaveri. So obviously, the area is so Shita, and more PCOD cases, PCOS cases were there. So we have seen more and more Vamana. The patients for Vamana subjected are so much more from the PTSR department rather than the other departments or even the Panchakarma itself. So, and the Vamana Karma gives so much instant results, and the patient feels better the day of the Vamana itself. Obviously, because of the Panchakarma, patient do feel good, and the next after, obviously patient has to follow the Samsarjana Krama and the Rasayana. Patient do get well, very well cured or managed properly, better than Virechana. But Virechana, we can see where there are more Drava Bhava is more. Say like Asrigdara is there are cases with menorrhagia. There are cases with normal period will be there, but the bleeding will be, I'm sorry, the bleeding will not be brownish or reddish. It will be more pinkish color, and but still the HP will be normal. In those cases, the Drava Bhava is more so because of reducing the Drava Bhava. We have to give Virechana. No doubt, Vamana Karma will also eliminate the Drava Bhava, but still Virechana has more is more easy in that cases. And also, obviously, Virechana is more easy to conduct in a patient rather than the Vamana Karma. So yeah, and but also there is Virechana. There Chakrapani mentions that the Virechana will reduce the obviously it is Pitta Vata Shamaka, right? I mean Shodhana. So, because of that, Saumya Bhava is, I'm sorry, Agneya Bhava is going to be reduced. But in cases where we are supposed to give or we are ought to give Virechana, after that we do a very rigorous Patya and the Rasayana, where Rasayana we choose like a bit of Agneya Dravya so that the Agneyatva is restored back. And this is my favorite procedure, Vasti Karma, where the patient doesn't need admission. They can come and go. And it is very what feasible for the patient also. They don't need to stay at home. I mean, stay in the hospital. And my UG dean used to say like Guda Darshanam Koti Punyam. So the thing is like Guda Darshana is like, oh yeah, Vasti Karma, and it's also a Ardha Chikitsa. So it almost cures everything, right? And it's very easy also. The patient doesn't need to take the Kadvi Dawa, which is in Ayurveda is infamous for. So yeah, the formulations used in the Vasti Karma, usually the patients are the obviously the patients are females and they are in the reproductive age group. So usually Yoga Vasti is say like I have given all the patients yoga vasti only. I have given only like say a handful of patients for subjected for kalavasti, say in chronic infertility cases. So and the tailas used for matravasti and the niruhavasti are Pipalyadi Anuvasana Taila, Brihat Saindavadi Taila. These two are a bit Tikshna, and the Mahanarana Taila, Dhanvantara Taila, and Dhanvantara Kuramba is, I'm sorry, it's a Yamaka mixed with this thing, ghee. Dhanvantara Grita and Taila, it is mixed, so it's Dhanvantara Kurumba, a bit more Brahmana, I would say. And at the same time, it's Vatashamaka also. Obviously, Kshirabala, we all know. Hingu Trangana Taila is what? Hingu, Lashuna, and Eranda Taila. So I use it left and right in my practice, and I have consumed it myself. Yeah, it is so horrible to consume, but still, it delivers very good results. And obviously, Sarshapa Taila and Sarshapa Taila with ghee, I have seen somebody practicing for just Matravasti, say like in very less quantities, 20 to 30 ml, not for many days. They also give gap like 2 to 3 days in between. Yeah, it is Tikshna, but I don't understand the logic behind that. So if anybody has some knowledge, please do enlighten me. And yeah, Dashamula Taila is famous, Rasna Taila is famous, Simple Yanada Taila is also good. And kalkas which we use for Niruhavasti in cases of PCOS is Shatapushpa, Ashwagandha, and Guruji and Shatavari. And yeah, Kashaya is usually Dashamula and Yeranamula left to right, Panchatiktaka in case of Asrigdara, and Guruchi also Aragbada in case of too much of Kapha. Yeah, then coming to the Ekadravya Prayoga, this is the very much researched thing. Curcumin. Curcumin is haldi. So curcumin longa. So the what are the researches on the curcumin is lipid profile if we 500 mg per day. Obviously, we all know curcumin is what anti-lipid, and anti-diabetic, anti-inflammatory, and all antis, not uncles. So yeah, so all those are there. So 500 mg of lipid sorry, 500 mg of curcumin per day for it was given for again 12 weeks. The lipid profile was seen, and all these data I have taken from the NIH. So the total cholesterol and the LDL was reduced. Triglycerides were also reduced. I have not mentioned it here, and the HDL was increased. Same with the same dose for insulin resistance also, because we all know Nishamaliki for diabetes, Prameha Harana. So, the same thing, it reduced the serum insulin, hemostatic model assessment of insulin resistance, that is the HOMA IR, that in insulin resistance, it's a new test, and for the fasting glucose levels as well as the increased quantitative insulin sensitivity check index, that is quickie. And anovulatory infertility, obviously, it is going to give and for anovulatory infertility, actually, the researchers were kind of here and there. It's 50-50. Some researchers say that it is working, some say it is not working. So it is still ambiguous, and many more researchers are needed on that. But there are positive results. Say, like we can say why it is more positive and negative. In cases of very chronic infertilities, might be it might not be working, or in cases where the patient is of Pitta Prakriti, and there is not much of Kapha Avarana. So in that cases, might be this might be working. So yeah, 60 over 500 mg curcumin BD daily for 6 weeks per orally. Decrease the CRP, C-reacting protein. Obviously, it is anti-inflammatory. It is going to reduce the insulin resistance. It is going to reduce the HbA1c glucose levels, and it is going to reduce the low density lipoprotein and the serum triglycerides, and increase the good cholesterol. So another study with 60 women with PCOS aged from 18 to 40 years old, administered with same 500 mg per day, shows the same thing. So there are different kinds of studies. You can go and see in the NIH. I have given the reference in the last page. So this is the HOMA which we already saw. So homeostatic model assessment for insulin resistance, and this is how it is calculated. This fasting insulin into fasting glucose divided by 405. This divided by is not seen here, and these are all the values. And usually, what these are the types of vastis I administer to the PCOS patient or PCOS with infertility patients. Usually, I don't go with the Raja Yapana Vasti or any Yapana Vastis, because I see this as Santarpana Vyadi, and even with patients with lean PCOS or the HH phenotypes, I'm not going with the Santarpaniya. I just give a bit of Brahmana Dravyas with these things only. So usually I give Madhu Tailika Vasti, where Madhu and Taila are the same quantity, or Ushna Agneya Vasti, like sometimes I've not given Churna Vasti, I wanted to try that. But I have given more of a Kashaya, very less of, say, like 50 ml honey, and 600 ml Kashayas also I have given. And Kshiravasti is obviously in case of Asridaras. And Nasya is the very, what I would say, like very easy way of administration, very less drug used and hassle free. Obviously, the complication is going to be more, but if it is not administered properly. So, but Nasya seems to be working really, really well. We are having a clinical trial for a PG thesis where Nasya is used for Asrigdara with the Udumbara Taila, and the results are really amazing. Obviously, the control group was Udumbara Taila Nasya with Bolabhadra Rasa. But obviously, comparatively, the other group was significant, but simple Nasya also was proved significant, because sometimes people forget to take medicines, or they don't like the medicines, they don't carry it sometimes. Obviously, feasibility issues are there, and Udumbara Taila was proving. And this, how this works is the Santarpaniyanam Siranam is the Nasya's quantity, sorry, quality. So the Vata Vritti, which is causing the nadis or the siras or the dhamanis, where the proper vahana of the dhatus or doshas are not there, and they undergo sankocha. And because of that, there is again Vatavritti more. And to correct it, Nasya is used, and the Sringataka Marma, where it is the located in the Shiras and foreign number Sadyapara Pranahar Marma, it is going to, and obviously it is the seat of Prana also, and Prana is going to circulate. I mean, Prana is obviously the Prana giving the energy to the Gatya Pakshepana, Utshepana, everything is happening because of that. So it is really also like Udumbara Taila, because of that, I don't know, because of Udumbara's property or Nasya's property, the endometrial growth is reduced. I mean, it's normal, it's not reduced in people who had polymenorrhea, who didn't have sufficient endometrial growth, but still their this thing endometrial growth was normalized, rather I would say lessened. So these are the Taila I have seen people using for Nasya. What I have used personally and on me also, and other people I have prescribed also, is Shirbala 101 and Dhanvantaram 101 and Anutaila and Shadbindu Taila I have used. I have seen people use Shatapushpa Taila. I am unaware of the complications or whatever. I have seen the benefits of that, but I'm unaware of the complications of what these things do. So yeah, then Shamana, if Shodhana is not possible, then Shamana is given. Obviously, na Shodhayet yad doshan samano dirayet yapi. And Sapta Shamana therapies are there. We know already that. I'm not going too much deeper than that. And this is my most favorite slide among this presentation. So yeah, the Gutikas, I have all these things I have personally used with the patients, and different, obviously different kinds of patients. Jasmine Gujarat used to say like individualized prescriptions, personalized prescription, tailor-made prescription for the patients. So yeah, so I have followed that, and I have tried many different things on patients, and obviously seen many these drugs. So obviously Rajapravartini, Chitrakari, Agnitundi, Amapachinavati are all going to what cause the shedding of the endometrium and Amapachana, if we are going both modern and the Ayurvedic aspect. Puranava Mandura and Annabendi Sinduram are mostly going to supplement the iron loss in the body, or they are we can say like Loha supplement, so they can be considered as both anti-shotha and going to supplement the dhatus. So it is going, we can say it as Shotahara and Brahmana. And Arogyavartini, Chandraprabha and all, they are going to normalize the liver issues, and they are Yakrit Prasadanas. And Yogaraja Gugulu, Navaka Gugulu, all these Gugulu has, Gugulu is usually here used as Purana Gugulu, but Purana Gugulus are also Brahmana. But here the Dravyas used are a bit Lekhana. So it balances and it brings the normalcy of the Vata. And Vilvadi Kutika I use left and right when the patient they have they have undergone quite a lot of allopathic therapies, because they consume OCPs in 3 month cycle for almost 3-4 years. and they come with even they have been injected with progesterones also in kind of chronic menstrual abnormalities. So for the what to say for dosha nirharana from the treatment which they have already undergone, first I used to give Vilvadi Kutika at least for a week, and then I used to take the patients for PCOS treatment. That is like preparing patient treatment, Purva Karma, I would say. And obviously, Brahmi were what uh, say like Manaprasanana and the Manasantapahara, I can say. Shivagutika, again, it's a rasna, use main ingredient, obviously, it's a Shilajitu, anti-diabetic properties are there, also it is a rasayana, so it is going to be overall drug or the drug of choice of me. So also like I have seen for the kashayas, I usually go for first, I have seen Mamta ma'am using Krishna Tila for every patient, so I like 50 ml TID before food for at least a week for bringing menstruation or initiation of the menstruation. And I use, first of all, I use Sukumara Kashaya or Dhanvantar Kashaya or Gandharva Kashaya for the patient, because we don't know how sometimes the patient seem like they have good sattva, but after starting the medicine, they have very low sattva and discontinue the treatment. So to avoid that, first I start with to assess the sattva of the patient, I start with these drugs so that there is Vatanulomana, Amapachana, and we can assess how strong the patient is, and also the palatability of the medicine we can assess the patient. So yeah, next the Tikshna Kashayas, which I have used is Chitraka Grantikati Kashaya, Ashtavargam Kashaya, and Varanadi, obviously widely used, Kanashata Hwadi, Lashana Erandadi, and DMK is not a political party, it's Dashamula Kadutraya Kashaya, where Amapachana happens extremely, Agnayatva is brought back, and simply Amapachana with Amapachana and Vata Shamana is Balajirakadi Kashaya, Rasna Pantaka, Saptaka Kashaya, and Panchaka Kashaya. Panchaka Kashaya is more I use rather than Saptaka Kashaya because it contains Shunti, it is Grahi, and Amapachana also. And obviously, we need more Amapachana in in these cases, because obviously the Kapha Vriddhi is there, Medo Vriddhi is there, and the Agni. And obviously, for patients who have gastric issues, but they do need Agneya Dravyas, but yeah, and we can't use them. For those patients, I go with Amritottara Kashaya or Indukantam to first normalize their Agni so that the other Agneya Dravyas can be administered. In cases where there is Rakta Prasadana is needed, I use Manjishtadi and Mahamanjishtadi. And other cases where there is HP loss and quite a lot of Daurbalya and Ama, I use Vasa Guduchari. Vasa Guduchi Triphala is what Vasa Guduchari Kashaya's content is, and it is used to it should be taken with honey also. It is mentioned in the Pandu Chikitsa in the Ashtanga Hridaya. So also Amritottara is also used. And if we go for insulin insensitivity, we can go for Nishakatakati Kashaya, Dhanadanayanadi, Asana Vilvadi. Asana Vilvadi I have used, like it is giving quite a good result, and Mustari for again Amapachana purposes. Saptasara Kashaya is my drug of choice when I don't understand the pathology. Obviously, we must not administer the medicine without completely knowing the pathology. But if we want to say like sometimes we can't completely understand the pathologies in those cases, because sometimes the patient don't reveal the full information. So in those cases, I go with Saptasara, where Erenda is there, Punarnava is there, and every action we need happens there because of Saptasara. So after that, when the patient gets relief, we can at least deduce the issue and we can treat accordingly, or change the medicine, or even continue the same. So yeah, and Bala and Guruji, uh, everything is what Vata Shamaka and things. In some cases where we see more of Vata Javritti and less Kapadushti, we go for Kashaya like Draksha, the Vidarya Panchamula, Laghu Panchamula, and Jatamansi and Kalyanaka Kashaya is widely used in the case where there is or mental issues. So, and the thylas, usually I don't use thylas because it is palatably it is very less. But in some cases, extreme cases, we are used ought to use it. So Hingu Trivana Taila, usually I administer with hot water or milk at night, HS mein. Say like depends upon the patient. If the patient has constipation, I used to give like 15 ml or even 20 ml I have given. I have also myself taken for 30 ml for Nitya Virechana. And Shatapushpa Taila is usually given for Pana, and Lashuna Shatavari Taila is used. And Kshirabala 101, Dhanvantara 101, Sahasradi Avati also I used with the Kashaya. Usually my prescription is like Sukumara Kashaya with either one of the Taila after like 1 week or 2 weeks. Because first we need Amapachana, that time we can't use Sneha. So yeah, next is for if we are going for we need Virechana, but the patient can't undergo either she's Sukumara or she doesn't have the time or something like that. We will give Nitya Virechana or Sadhya Virechana. So usually I go for Nimbamritadi Eranda or Gandharvastadi Eranda. And Gandharvastani, obviously Chikkanapakka is used. And results are quite good. The patient have like for Nitya Virechana, patient used to have 2 to 3 loose stools per day, and for Sadhya Virechana, people get like I try to adjust the dose until they get like at least 7 Vegas. It's not the trip to the bathroom. It's the Vegas they get inside the bathroom. Like say they go to the bathroom once, but they can have 2 Vegas in one sitting. So it's like that I do. And obviously the churnas which I use are Hingvashtak churna for obvious reasons, and Hingvachai churna in case where Amapachana and bleeding control is needed, and Hingvashtak churna is bit tikshna. So Amalaki, Haritaki, and everything is we already know. This Trikatu and Nagakesara, when I was in PG, my senior Dr. Swati, her dissertation was on Trikatu plus Nagakesara's churna with ghee for ovulation induction in the infertility people, and the result was quite good. And obviously, Trijataka for obvious reasons, and Trifala for again obvious reasons. It clears the mala, it reduces the insensitivity of the this thing insulin, and for obvious reasons we know Nishamalaki churna is used in prameha as agradravya, and Grita is usually in cases of Vata Prakriti person and Vata Vriddhi Vikara only we use Sneha. So in those cases, after the Amapachana is completely done, only when after that knowing we are under administering the Grita. So Dadimadi Grita, Shatavari, Mahashatavari, Palagrita, Dhanvantara and Indukanta Grita, all these Grita are given in patients they have other gastric issues. And the for Santapanasha, Kalyanaka and Mahakalyanaka and Panchagavya. Panchagavya is really, really good in the all the PMS I have seen. I have personally taken it and I have administered it to my students also. Results are pretty good, really, really good because it is obviously mentioned in the either Unmala or Apasmara Chikitsa, but palatability is very bad. So if and obviously the market may capsules are available, so it is easy to consume now. But the Udgara after that still contains that smell. So I don't know. It again depends upon the patient. So and Avaleha, I usually used to prescribe Avaleha in my native. My native is a Sadharana Desha. So after the Amapachana and Sneha, I can go for Avaleha for Rasainas. But right now in the Pradesha I am there, I don't think Avaleha use can be used much. So I'm skipping this. And Rasaushadis usually I again don't use Aushadhis, but Rasaushadhis I have seen people using and getting good results. This Pushpatanvara for ovulation, this thing again Nashtapushpa and development also Chandrakala Rasa for Asrugdhar same. Loha Basma and Abra Basma. Abra Basma I have seen like it acts as like say if we give Abra Loha, Loha's availability is made more for the absorption. So Asavas and Arishtas are my favorite. Oh my god. Then I use Abhyarishta to say like in cases where Anulomana is needed more. Obviously in every cases Anulomana is needed more. Manavata Dushti and Kumari Asava in cases of issues, Ashokarishta and Lodhas. Lakshmana Arishta are used as uterine tonics. So either it's scanty, it's a no-brainer. It even if scanty or the excessive menstruation, you can use this. Draksha Sava in cases of Daurbalya, and the other Angasada is there. And Dashamula Arishta, Dhanvantara Arishta, all Mustaka Arishtam and Jiragasam or Jiraka Arishtam. Oh, so all these things are used when in cases of say like Vatavriddhi is there, and these are very palatable to Asavas or in Aristas, and also like we can get both the alcohol solvents properties also and water-based solvent properties also. So Asavas and Aristas are my favorite until and unless patient doesn't have any issues consuming them. Say like some people, especially in the summer, might have gastric issues, say like burning sensation or belchings, sore belchings and all. So in those cases, it's better. And the other uses, other things I use are Sarivadhyasava and Saraswatarishta with gold. I forgot to mention the gold there. So those cases are obviously reducing the mood swings, irritability, and the brain fog. Brain fog is, trust me, it's a real compromises of life. And obvious reasons for liver tonics, Bringarajasava, Panchakolasava, and Pipalyasava. Pipalyasam, I do use it, but not with the Pitta Prakriti people. And I don't use it for quite a long time. I use it just for like, say, a month. After that, I stop it for obvious reasons we know. And the on the Tisreshna, like the Sattva Vajaya is the thing. Deva Shreya will be next. So Sattva Vajaya, which is acting as a quality of life. PCOS is not generally people do get affected physically, but those are what to say, objective reasons which come for which they come for consultation. But the subjective reasons which they don't know, or they are not even aware, is they are having mental issues, because there is a taboo, like say even us doctors, we don't reveal like we have anxiety, or we don't we have PMS, or we have depression, because obviously it's going to be compromised because of our mental state, and we have done quite a lot of mehnat for that. So but this should be what taken care by us only, because patient usually don't reveal it. And we have to remove the attenders from the patient to get this history actually. So I do tend to do that, because the patients we get here are mostly low socioeconomic people. Them approaching the doctors itself is a big deal. So, and under the supervision of somebody else, they are obviously not going to reveal what is going to happen with them. So I tend to remove everybody in the room, just me and the patient. I just talk with the patient, and I get more info from them. This is what I do. And I'm not telling this is correct, but this is what I do. So, and if I'm wrong, please correct me. So, Sattva Chikitsa is counseling, and Manas Santapahara Chikitsa, obviously. And we can go for Bastrika and pranayamas, Brahmari pranayamas to reduce the stress level. Because serotonin, obviously, for obvious reason, it is going to hamper the metabolism, and because of that, insulin sensitivity is reduced. And again, the pathophysiology is going to be continued. So, Yoga Nidra, people tend to have Viparita Nidra nowadays. Say like they are awake in the night and they sleep in the day. So to combat that, Yoga Nidra and taking help of the professional, mental health professional is very much needed. For the first line counseling, we can do it ourselves, but if we sense like patient is having some depression or anxiety, or if the patient has some domestic abuse, or because of some other stress or something like that, it is better to refer to the say like the mental health professional or manasika chikitsa vaidya, sattva vaidya, so that the patient's cured from every side, multidisciplinary this. So sattva jaya punah uh, ahitebhyo arthebhyo manonigraha. Manonigraha is what is attained from the counseling, because unless they accept the problem, unless they don't know, obviously they are not going to accept. So once they accept the problem, they will search for solution, because nobody want to be a defective piece, or a manufacturing defect, or any defect with them. So until and unless they are having the mental control to come over this thing, they chikitsa, I don't know, it is going to I don't think it is going to work for them. So my favorite topic, or the topic which I want to learn more, is the Daivavya Pashraya Chikitsa. So until till now, or the my very small days of practices, what I have seen with the patients is like the patient tend to lose their feminism. See, sometimes patient doesn't like they sometimes like female clothes, they don't like to dress up, or I'm saying these are the causes for PCOD. But in PCOS patients, this is not present. So, and sometimes what people, because of the voice hoarseness also, they sometimes think as they are males, and because obviously the testosterone hormone is more, they tend to behave like males. So yeah, so to compare that, I think Daivavapashraya Chikitsa is much more effective. I'm not telling other things are not effective. This is, or if it goes hand in hand, it is going to give us results much easily. So it's going to prevent the also it is going to enhance the quality life. So दैवविपश्रय चिकित्सा is mantra, aushadha, mani, mangala, bali, upahara, homa, niyama, prayasitta, upavasa, and swasthayana, and pranipata gamanadi. So we understand mantra, aushadhi is what we give, and money is, or the gems, mangala bali is what sacrifices given in temple, upahara and homa is havan we do, niyama is what the japas and all we follow, prayaschitta is the temple visits, and upavasa is fasting, swasthayana is following some kinds of vrata, and pranipata gamanadi is the they I don't know if it's still in the use. I have seen people going padayatra for all the temples, especially Girivalam. It is there in the Tamil Nadu's Tiruvannamalai temple. So during the Deepam festival, after the Diwali, we have a Deepam festival, say like 45 days after the Deepavali, and people used to go around the Annamalai mountain thrice, or whatever the number it is mentioned. So it is also a kind of Daiva Vipashraya. So what do we understand from the Daiva Vipashraya is it is like believing something good is going to happen, or it is the belief, like say it is my life, I am what control of my life, and I am going to be humble and kind and also courageous, is what I understand from the Daiva Pastra Chikitsa. It is like, say, we all know, we have studied from the Sushrut Samhita, like Mahata, Ahankara, and all the other stuffs which follows that. So, obviously, we are a part of Paramatma. So, when the Samne Wala is also a Paramatma, so we tend to obey people, or we tend to listen, or we tend to take the words properly. There is no hitopadesheshu asahishnutta, as it is mentioned in the Jwara. So obviously, when we tend to listen more than we use our mouth, we use our ears, we tend to hear many things. When we tend to hear, obviously we are going to put it into practice, because we don't want to be a defense. So, and because of that, obviously the quality of life is going to be good. And when we are going to good deeds or good practices, and we will be less tempted towards the evil thing. Obviously, gradually we are going to attain the moksha. And the shlokas which I advise to the patient, or I have advised till now to the patient, are mostly Shakti Upasanas. Because I used to say, I mean, I have learned from somewhere, like from my senior actually. My senior used to say, like, for PCOS patients, especially he advises the patient to, even though if she is not willing, ask her to give say like wear female clothes, or say like I'm not against feminism, or I'm not towards feminism. I'm just telling her, do or be like a female. I would say I'm not going much into a detail of that, because I'll share my own PCOS story, because I suffered from PCOS quite a long back. I have come out of it, so I'll tell my experiences from that. So for right now, what shlokas I advise to the patients is Aditya Hridayam for every patient, not just PCOS. For every patient, I advise Aditya Hridayam. It is from the feet of Agastya Maharshi, and to the Rama, to recited to Rama when he was about to go to the Yuddha with Ravana. So it is said to be like obviously on Aditya, obviously this Arogyam Bhaskaradi. So and also like Aditya is he um brightens everything. He shows the path. So if the in your Jataka, if your Aditya Dasha, I mean Aditya or the Surya is what to say covered by some other I'm covered is not the proper term or shadowed by some other graha, all you will have in life is confusions. So when the Aditya is shining bright, obviously you're going to have light for the path, you're going to do good things, you will at least know what is good, what is bad. So when the visibility is more, obviously you're going to what is right for you. So Aditya Hridayam is what I personally do every day, and I'll ask the patients to either recite to it. It is best to recite after a bath, or at least listen to it after bath. So next is the Lalita Sahasranama, Kamakshi Stotra, or Durga Sapta Shloki, or Lakshmi Ashtotra, or Kana Stotram, which is obviously everything is available in YouTube and Spotify, other apps. So you can just it once, and obviously to give you in the mornings it is going to give you good vibes so that the day is good. Yeah, obviously if the day is good, it is going to continue as a week and month and year and obviously the whole life. So and also I advise the patients to visit temples, especially the temples which have Devi Murtis. On Tuesdays and Fridays, take head bath or oil bath on Tuesdays and Fridays, and light a ghee diya and there, so that you get good vibes from there again. And volunteering for social works is I didn't advise it, but I have seen people doing it when they have PCOS, they tend to take care of children. That kind of social works tend to the children, or say like matratva bhava, mamta, that kind of bhava is when we do it from the outside, when we are giving some stimulations like that, PCOS tends to decrease actually. Yeah. And then obviously dana and dharma is going to help. So coming to the pathya, so what I advise to the patient is I say it like no dairy items. Initially, I mention all these things: no bread, no bun, no biscuits. People think biscuits are very healthy. They are in a different form of bread and bun only. So obviously pastries and waffles and brownies and muffins for obvious reasons of sugar and insulin resistance. People think maida is like it tends to stick to the intestines or the stomach wall, and it is not going to be digested. It kinds of forms ama. Actually, it is quite opposite. It gets digested very easily. It is going to spike the glucose levels in the body, and the insulin secreted is not going to be enough, or then even if it's enough, there becomes insensitivity to the insulin, and because that problems arise. So that is the reason why these bakeries or that usually asked to avoid. And obviously for ice creams or usually vegetable oils, and not many frozen desserts, I would say tea and chocolate, except for the dark chocolate, 90 to 100%, it's not supposed to be consumed. Curd for the Vidahi reason, and lassi for again same Vidahi reason, especially in the nights, which is going to the Agni, which is spoiled. Bichara. Avoid dairy items except ghee. Dairy items in the sense I say like milk, uh, milk and butter and curd. I do advise ghee, and I do advise buttermilk. Ask patients to avoid this because curd is not advised. The Aditya Tyakta Takra is very good because Shakulavam, it is really very good. And obviously for gruels, rice gruels, or what we give in Samsarjana Krama, like Peya Manda Vimal, they for obvious reason, they are very good for the people in the say like Agni Mandya, but here Agni
Time,
Mandya is
madam.
there, but we don't need the. Hello? Yes, sir.
Time actually only 5 minutes are left.
Yes, sir. I'll finish now. So gruels for it spikes up the insulin levels to really high level. So and digested because of that. So Viruddhahara again they are going to cause Agni Mandya, and Vishama Agni again. So we have all discussed this Nidra Viparyayam, Avyayamam, Vegadharana, especially in the schoolgirls, and Krodha Shoka by Isha and Raga for mental reasons. And it is said in the Vedas like the precursors of Papa Karma is Atyashana. It's not any other Panchamaha Papa, it is the Atyashana. You eat more and do the work, you take mind is devil's workshop, so you tend to think more things which are not good. So atyashana is not advice. So patya is priyam tanmana bhojanam and kala bhojanam, and kulata masha and tila hingu haridras. Sprouts are really good because they contain more agneya, they are more agneya in bhava. And for barley for these reasons, rajaswa, yeah, this only I will elaborate a bit. So in Tamil Nadu, so yeah, when the girl attains Menar, ways to sit in a retreat. It's really done these days also. So they have a mat. From that, they are advised to sit there, not in the ground, not in the bed, and there is a ulukal, this uh, Mangala Rakshogna purposes, and the person and the relative who is also in periods is asked to know what and menstrual hygiene is proper to her, because obviously for priorly she cannot be taught with that. And also during these 3 days, for even for all the 3 meals, she's given something called manja pongal. That is, manjal is haldi pongal made and given to her thrice. And priorly said reasons which it is followed. And on the fourth day, she is the done, and a very big festive, I mean, very big function is conducted. And during this menarche period, during these first 3 days, she is given with kashay, laddus. Urad ka black urad is made it into powder, and jaggery is added. It is into a paste and it is given for all 3 days. Obviously, we know masha and tila is very useful in the Rajaswala. So I'm skipping PCOS. And the issue of Garbhaparichari is what we have already seen. Like, even though if you have disorders, because of Garbhadi Parichariya, you can be I'm not can be married. Prahlada was Asura Kula Balak. He was taught during the Garbhaparichariya, I mean, she was good wife, good hands. Because of that, boy turned out very well. Garmendaria is very important. And if you remember the first line, first the Asura is very big. Right now, Asura is very small. And with the knowledge, Maniyana, knowledge, we become bigger. We have more strength to combat whatever we want. So the take home message is Nidharam Shreyo Paradharmo Bhaya. So do whatever you want, I mean, do whatever you're supposed to do. And doing other people's dharma is obviously not in your syllabus. And use for Prasuti, you Kaya Chikitsa's exam completely no use in Prasuti exam. So I'm just giving an example. So whenever you are to the rest part. And motivation, discipline or sankalpa is very important. The sankalpa is what I can do it, is what is needed in the PCOS. So thank you all. This is the reference. Thank you. Hari Om.
Excellent, excellent.
That's all from my side.
Hari Om. Excellent, doctor. Excellent. Your presentation was so excellent that I couldn't stop you. Even time was passing out. So, Kamini ji,
जी जी बिल्कुल बिल्कुल
really
बिल्कुल
you select diamonds. Really you select diamonds. Excellent. Excellent.
Thank
Kamini.
you,
Thank
sir.
you. Ji,
Thank you.
thank you, Vasuprata. It was really, sir told us. Nice presentation. You have covered all the topics, all the aspects of treatment, Nityoprashay, Devaprashay, Sattva Chikitsa, everything you have covered. And it makes the topic very interesting for all. So the time is over. So thank you so much, all the experts whosoever joined over here. Thank you, Pawan sir. Thank you, Ms. Prida.